Um, the the meeting format tonight. I'll ask you to mute yourselves during the intro. Rosemary Driscoll is our moderator and will introduce our speakers. They will give brief introductions to their organizations. Each has received TPC grants, so there's some familiarity with their programs. But what we'd like to encourage you all to do is pose questions that you want to hear answers to. These can either be done verbally, you can unmute yourself and ask them during the course of the event, or you can populate them in the Zoom chat. The final recording will be posted to the TPC site, and that acts as good reference material that helps our organization really understand the organizations in a much deeper way. We will plan on stopping the recording promptly at 7:30. We'll continue for a few minutes just to wrap things up. So if you're interested and have that time available, feel free to join us for the extra few minutes. And with that, our event tonight is really focused on two organizations that support and empower both women and girls through very pivotal transitions in their lives. And I think you'll find this a very interesting discussion. I will hand it off to Rosemary to help kick it off.
Okay, well, thank you very much. And I'm Rosemary Driscoll, and I'm very happy to be have the privilege of sort of moderating the session tonight. I am on the board of TPC. I also am a point of contact for both Girls Leap and Family Health Project, who are the two grantees that we are featuring this evening. I just wanted to, before I give just a snapshot introduction of our two grantees, I dropped into the chat, those of you who are here, just to add to, if you haven't already signed up to be on a grant team, it's still time to do that. And it's such a wonderful way to really get your hands involved with the organization. So I'll drop it in later as well, but there's a little survey to be filled out, and please do it. It's in the chat now. So, or copy it and do it later so that you're paying full attention to everything that's going on right now. So yeah, as I said, we've got the privilege of having Mae Vaughn from Girls Leap, who's the executive director there. She's been there for not too long of a time, but has many, many years of nonprofit leadership experience. So she's going to talk about Girls Leap, and then we'll be asking questions. And then Joe Knowles is the president of Family Health Project, and he will be going through some of the information about each of them are going to do a little bit of an overview of their organization and some of the impact things, which is a great way to kick off some of the questions that we have prepared. A few questions, but we also absolutely encourage you to drop questions into the chat, or once the little presentation part is done, you can unmute yourself and ask a question. So with that, I would turn it over to Mae and hear a little bit about Girls Leap.
Thank you so much, Rosemary. Thank you everyone for taking the time, and all the members, all the TPC members. Thank you for your giving in addition to your time, giving back to organization. Just to give sometimes is great, but to give and to come listen and also volunteer is fabulous. So thank you so much on behalf of all the little girls watching you. Next slide, please. I would want folks to read our vision and our mission because I really want to make sure that I get some things out about what Girls League does, why we do what we do. 90% of all victims of sexual assault are young girls, not only in Massachusetts, but in the United States. 3 out of 4 parents have not discussed domestic violence or sexual assault with their children. Girls ages 10 to 14 are most at risk for sexual assaults. That is why we do what we do. The violence that surrounds girls, not only in the city of Boston, but the state of Massachusetts and the United States. The inequities in schools and healthcare, housing instability, the neighborhood violence, and the mental health crisis around social media. And we'll talk a little bit more about that later. And 80% of girls in Boston public schools have been bullied. That's why we do what we do. And a lot of people sometimes think about Girls Leap and they think about the physical aspect. We do a lot more of the physical aspect. So if you look at those pictures that are surrounded on this slide, we're talking, we're learning how to use our voices to advocate for ourselves. We're using we're learning about mental wellness and what it is to ask for support, ask for allies if you need it. But then again, we also are teaching girls how to physically protect themselves if for some reason they're in a situation where they need to keep themselves safe. 15,000 of the girls that we've served over the last 25 years of girls of color and girls in the inner city of Boston. 90% of them are girls of color. 75% of our work is done in Roxbury and Dorchester. And I am proud to say that 70% of our board of directors live in the community, are from the community, and are also folks of color. We've been around for 26 years. I hope everyone here comes to our 30th anniversary in a couple of years, but we've been around 25 and hopefully 25 and a half. And we want to be around for the next 50 years, or hopefully we don't have to be around. That is what we're focused on, and making sure that girls and non-binary youth feel safe in the communities that they live. We run our program in a variety of ways, and I know we're going to talk about that with the questions. But what we do is we partner with organizations that are working with girls and non-binary youth, and we come in and we partner with them on working on social emotional well-being and physical well-being. We provide opportunities for connection, safety, respect, meaningful communication between youth and peers, and opportunities for youth to find their voice. Our recent results. So if for those who may have been on a grant committee, we have served now over 500 girls a year through our programs. We've had a 40% increase in the last 2 years. We have developed different programming. We now offer school vacation week. So instead of parents just saying, okay, I got to come every Saturday so my daughter can learn how to be safe, we offer alternative ways so every girl, despite all the scheduling and challenges that families have, are able to find ways to protect themselves, and we're able to make sure that we're reaching as many girls as possible. This year, also one of our highlights is that we've partnered with Boston Public School. We now run a summer learning academy. So for those who don't know, for youth to not experience the summer learning slip, so the girls get academic STEM education in the morning, and then they get girls leap self-defense, physical and social emotional self-defense in the afternoon. So that's partnered with Boston Public Schools, and we hope and we plan to do that again next year. And we also, a little later, I hope to talk about our media mindset if anyone has any teenagers now or any elementary ed folks, kids, you know that social media is now what's affecting not only girls but boys as well. And that's where all the bullying and the violence is starting. So we now have added a different curriculum aspect to that as well. So that's what we do. We want to make sure kids feel safe. Girls and non-binary feel safe physically and social emotionally so they can develop into adults. Thank you. That's 7 minutes, Rosemary. And then our recent results. Sorry, I should have probably controlled the slides, but these are our recent results. That is a picture of our teen mentor program. So that's run out of the Dearborn Elementary School, and that's with Children's Hospital. We were lucky enough and blessed enough to be able to get a 2-year grant from Children's Hospital that's supporting our social media safety component. And I did highlight these things. Our media mindset is what I hope to be able to talk a little bit about later, and what TPC was able to support us with as well. Next slide. Here are some results too that are alumni. We have alumni for over 25 years. Here are some quotes from them. Last 2 years ago, one of our youth was Youth of the Year for the city of Boston. We actually have one of our youth also who's just been accepted to Harvard, one of our seniors, and we are super excited about that as well. We plan and we hope, one of the things that we plan and we hope to do is to start a scholarship funds because a lot of our girls graduate going on to college and need a lot of support. So that's something, if you kind of stay up with us, you'll start to see that will start to develop as well. Next slide, please. We believe that every girl non-binary person should have access to Girls Leap. And because of TPC, you guys have been a part of that. So thank you so much. I look forward to the conversation. And I'll pass it on to, I think, Rosemary now.
Yeah. Thank you, May. That was great. And I'm going to just go right to Family Health Project and ask Joe to kind of give us a little brief overview. And if you want to just tell Nicole when you want to move the slide ahead, that will keep us on track. So
Perfect. Good. Thanks, Rosemary. And thanks, May. That I'm incredibly impressed. Not to say that I wasn't, I'm not surprised because I know I have heard about your program. But the outline of the issues you just provided was breathtaking to me, and an eye opener. And congratulations on 26 years. That's really impressive. So good for you, and thanks for sharing all that. I apologize. I'm in a Starbucks on Route 1, having been caught in traffic, but I'm going to do my best not only to present to this crowd online, but also maybe to a few of the people here who are now paying attention. So there's kind of a bonus. Thank you all for making time. I will try to cover as much ground as I can, as quickly as I can, knowing that our time is somewhat tight. We are a direct cash benefit program for first-time moms living in deep poverty. We work directly in connection with and collaboration with two federally qualified health centers in particular, and we are looking to expand even as soon as January because of our success in fundraising in the last 6 months. Thanks to my colleagues, Katie Mizuraka and Dana Branco, who are both on this call. We have copied almost directly a larger program that has been in operation for 4 or 5 years, a research program out of Duke University called Baby's First Years. 1,000 moms in 4 different states, and they've been tracking all manner of outcomes that are quite positive, some that are a little middling. Having said that, we know from other research in almost every other country, OECD country, that cash benefit programs for children work and work well. Next slide, please. We worked, as I say, directly in connection with FQHCs that are all across the country. We designed Family Health Project from scratch to scale. What that means is we do not have to add appreciably to our overhead and admin costs as we grow the program in terms of beneficiaries and other collaborators and other qualified health centers across the country. We aim to double in size next year and do that again the following year. We have 15 moms in each of 2 new cohorts, one in collaboration with Lynn Community Health Center and the second with Whittier Street Health Center in Roxbury. We finished 2 earlier cohorts in the piloting process that ended about 8 or 9 months ago, and immediately started 2 new cohorts in each of those areas. We're looking to get to the western part of the state. We're looking to get further north as well. A big piece of this is showing how simple it is to run a direct cash benefit program. Next slide, please. We have an interesting challenge ahead of us, and I'm hoping that TPC can help us with it. In fact, I'm sure you can, which is we will never have, as biostatisticians say, never have a big enough N or sample size to do quantitative reporting. On the other hand, we know from the stories that we've gathered and from individual moms and babies what it means to have $400 a month reliably every month for 36 months without condition. Not only have we had one of our moms complete her nursing training, given the money that was coming in, we've had others, May, I'd point this out, who were victims of intimate partner violence who were able to leave their domestic situation for a safer place. We've had that happen in a few different instances. Um, we've had something as simple as a mom able to buy a bus pass for their partner to enable them to get to the Home Depot on Route 1 for day work, which has meant the world to that family. We've had others that were able to save a little bit each month and effectively garner their own bank account going forward. All of these things seem so simple to most of us, but $400 a month to many of our neighbors is an awful lot of money, and it's a game changer. As one of our moms said, and it's in the video on our website, if mom's happy, baby's happy. But at some point, we're going to have to determine how best to evaluate what we do, what the impact is. We can gather stories, and we're doing that now, and the outcomes are quite clear. And we can reach across borders for the international data on exactly what this program does in places like Norway or France or Germany, where literally they are doing $400 monthly payments to newborns, for newborns. Um, but there's some way to do the measurement piece and help us make the case that this has the impact we know it's having. I think that's the last slide, but I'm not sure. There we go.
I wanted to thank you for doing that. Oh, look at all these wonderful faces that we can see now. It's great. Hi, everybody. Thank you both, May and Joe, for doing that overview. And I think it's just helpful to just be reminded about how great it is that we funded these two organizations. That's the first thing that I'll say. I have a few questions that I've kind of prepared and ran by the presenters. So I'm going to go through a few of those with the time that we have, but I really will encourage those of you who are in the audience to, if a question comes up, to either unmute yourself, give us a chance to ask a couple of questions, but then put some in the chat or unmute yourself and ask a question. I'm going to start with what I think might be a very obvious question, but I know it's important for me to think about this, which is, why is the focus on moms and young women particularly impactful for us, for society? Again, maybe it's an obvious thing. I'm going to ask Joe if he doesn't. Well, he just spoke, so
Sure.
maybe we'll let May.
No, that's
Okay,
either.
Joe, you ready? You want to
Sure.
hear it? Okay.
Yeah,
And then we'll let May.
I'm a public health person, having gone back to school 25 years ago to get an MPH. And as I was looking around and surveying the world of public health, which is all about the health of populations, I was looking for uh, the best population to work with if you're looking for impact on a relatively short dollar. It turns out that the age prenatal to 3 is the critical time in a human's development, period. There is no better time to intervene, no better time to make the world a safe, comfortable, happy, nourishing place. What we know from the research on poverty is that kids, babies in particular, growing up in poverty show signs of PTSD. Cortisol measurements of cortisol in hair and other samples show that poverty has a physical as well as a mental and emotional impact that can rarely be undone. So the best time to intervene is 0 to 3.
Thanks, May. Did you want to add again, sort of, why? Why is this
Sure.
so?
Sure. I first of all, Joe, I'm almost in tears because I used to, early in my career, I worked in early ed. and you can definitely see, in family nurturing centers. And I remember like just the programs that we would do would impact families for generations. So what we work with older girls, right? We work with girls starting in elementary school, and what we're trying to do is build their assets, build build their resilience, so they don't end up in the situations and Joe work, be becoming your folks that you're working with in 20 years. So we're really in the prevention work. And hopefully they don't get to the point where they would need your services, Joe. But yeah, so that's my response to
Got
this.
it. That's great, May. You got it. You got it.
Yep.
Yeah. Thanks. I'm going to just again jump in because I've heard from other dialogues, not just necessarily these two wonderful organizations, but I think what's on everyone's mind, or at least mine, is, what is the current political climate? How is that affecting the delivery of your mission, of your services, if at all? Maybe it hasn't made a difference, but I think it's just helpful for us to hear any particulars. And I'd let either May or Joe, whoever wants to unmute and answer that first.
All right, I'll go first because I'm sure Joe has a lot more to add to this piece. Well, one is just to start with funding. I think every organization, because we're like we're still a pretty small organization. So because of the federal cuts, a lot of the funding that bigger organizations would apply to are now applying to what we usually apply to. So we're seeing sometimes we're seeing folks still give to us, but they're giving less, right? So they're giving less. They still say, we still believe in your work, but we want to kind of spread it. And we want to spread it into food and housing. And I bring up food first because one thing that we've had to do in our programs is now offer food. We were feeling that before. We were feeling that before. But now, moms have said, hey, if my kid can eat, they'll say, if not, because we don't have enough food and I have to do this and do that. If I can work late and you can feed my kid, then it can be in the program. So we now have shifted some funding around, and especially in our teen mentor program, where the teens are with us 3-4 times a week, we would just offer snacks. Now we're offering like you don't have to go home and have dinner. We're gonna give you dinner here, so that kind of takes that pressure off of the parent. And also, in our foundational programs to in elementary schools, we do a program in Somerville. They provide meals for the whole entire program because they felt that a while back, but now we've made that adjustment. And we're hoping that we'll be able to apply for some funding so we can continue until, we feel like, I don't think it'll ever go over because kids are always hungry, but they're really hungry now. And also the staff, all of our staff are from the community. A lot of our staff are probably still in school or working very part-time jobs, so they're feeling the impacts as well. And everything that's going on with women and reproductive right, all we explaining that to the little girls and helping them to understand the political climate too is also something we struggle with as staff because we're like frustrated about it. So having those tools to be able to have those conversations when they do come up in program. So thank you, Joe. I'll pass it to you.
Joe,
Or-
would you, yeah,
Yeah,
what's the political climate impact?
I think that it's had a number of different types of impact for us. One is, I guess a redeeming element is it's been so dire and frankly so disgusting to the folks who are supporting us that we're able to make the point that if we who are doing the work just put our heads down and do the work, and think of that as a privilege and an incredible, it's a blessing to be able to put our anxiety to work. And that's basically, so that's become at least part of my message. On the other hand, it's bleak and May, you spoke to it. It's there's a lot of competition for fewer dollars. Um, you know, uh, most organizations are worthy and have been, and then suddenly the funding is gone and they've got to figure out how to replace it. Um, it's pretty dire for us and the moms and babies that are participating with us. Um, it can be pretty difficult in part because some of the moms that we work with are undocumented. Um, and we've actually had an instance where a prospective participating mom declined because they were so concerned about their data being used or somehow something being compromised. And that breaks my heart, breaks my heart. So,
Yeah. I mean, I guess what I'm hearing from both of you is just, again, maybe an obvious thing, but that the interaction of things that are happening even outside of your organizations, that ripple effect is
right.
having a very
Yeah.
definitive effect on your populations, and it sounds like even on the programming that you offer.
Yeah. Yeah.
So somebody had put in the chat, and I'll just ask I'll ask this. There are two questions for Family Health Project, and then I'll get back to a couple of my questions. One is,
Sure.
where does the number $400? Like, how did that magically come up? And
Yeah.
kind of related to that is just, can you just very briefly talk about we'll call it the choosing process, like
Sure.
how a
Sure.
mom gets in the program, and then we'll come back to May with a question.
Yeah. The $400 a month, when we were looking at other programs, in particular babies' first years, they do $330 a month. The math is impossible for me. I can't times 12. I don't. Honestly, it was just so simple to say it's $400 a month. And what's interesting is, as we look at other countries, and by the way, every other OECD country does a child benefit program that's government run and consistent. And most of them are doing it for the better part of a century. They must know something we don't yet know. Having said that, when I first called the CEO of Lynn Community Health Center, Kiami Mahanya, he said, it's amazing you're saying $400 a month. He said when he was living in Germany, he had his first son, and he said the next week a check arrived for $400, and the same check arrived every month until his son was 5, $400. So I don't think there's any magic to the number, but it seems to make a substantial difference. When we're choosing moms, we leave it up to the community health center. There's a very thin screen that we use, meaning not a lot of elements to screening anyone out. We are eager to prove success with a very defined cohort that in turn should help us scale. These are all first-time moms living at a certain percentage of poverty level, almost no matter how you measure poverty of the 3 different ways to do it. And we only screen out for substance abuse disorder or serious mental health, because we typically can't succeed there. That's a page we borrowed from babies' first years as well. But effectively, it's almost a random approach from case managers at both now Lynn Community Health Center and Whittier Street Health Center.
And those are so currently those are where the 2 cohorts are coming
Yes,
from, just those
right now.
2.
Yeah.
And the scaling that you mentioned a few times,
Yep.
it would happen by adding obviously more cohorts, but adding more partners.
And well, both. We
Referring.
want to add more in Lynn because the need is so great, and we know them really well. Possibly Whittier as well, but we'd like to get to a third location as well.
Okay.
There's a world of hurt out there, as we know.
Yeah. Since we've got some questions in the chat, I'm just going to keep bouncing back and forth. But May, there was a question that I know you want to talk about this because you mentioned it a couple of times about I forget it was a double M, like media, like minimizing media.
Yeah, our media program. Yes. What was the question? Was there a specific
The
question?
question was actually, are you involved in limiting access to social media?
Okay, so let me start with our media mindset. So one of the new things for Girls Leap is that we now provide training for families, caregivers, middle schoolers, and high schoolers around being safe on social media, what it means to be safe on social media. So that is our new component to safety. And that is true to, I mean, if you guys can see the data on what's happening on social media with youth. So to answer the question, yes, Girls Leap stands behind limiting social media. We are in alliances and groups. We do believe in no phones in schools, and it is hurting our girls and it is hurting our youth. So yes, we do stand behind that. If that, and it's hurting adults too, but that's another.
As we're sitting on Zoom, but this doesn't count as social media. This is a different thing. It's a different thing.
Yes.
There's a couple of questions for Joe. One is I'm going to ask the second one first. One was I think it was Sarah Rahman asked, could you elaborate on what you mean when you say it's easy to run a direct cash assistance program?
Yeah, I can almost hear Katie and Dana rolling their eyes saying, "Yeah, you think this is easy?" Um, no, I didn't. Maybe I might have oversimplified. What I meant by that is when we designed the program and then piloted it, we knew what we wanted to do was expand it, scale it, copy it over and over and over again without appreciably adding to expense. And so to do this, we've automated almost everything, and we've kept the idea very, very simple. We replenish the debit card. It's the same debit card each time. We do it automatically. We're able to track financially everything that goes on. Um, I'm trying to think of what else. Where the health centers are all in. We're able to track their activity as well. We have an amazing support person, Kelly Journey, who is both with the health centers and with moms to make sure that everything is up and operating well. They're able to reach Kelly at any hour of the day when they need to. Um, so it's a very simple program and a very simple idea. And I guess easy might be the wrong way to say it. But that's really what I was trying to convey.
Yeah, it sounds like it's a simple model. Doesn't
It
necessarily
is.
mean it's an easy work. Because someone also asked, I think it was I can't remember, Susan, and was asking like if financial literacy, like an actual program around
Oh,
financial literacy, was part of what the model is, or
a great question. Not really. Not yet. I guess is the right answer because we're looking at other things that we might add in one way or the other, and we're being very deliberate about what we may add. We're asked about that. We're asked about other wraparound services, or at least connecting moms with other wraparound services. Which, by the way, the community health centers are really good about that. We've all become schooled in social determinants of health. It's a big, big issue with community health centers in particular, but not yet. We're
yeah.
looking at that, and I think that's something TPC could help us with at some point as well.
Couple of questions for May, then I'm going to just grab from the chat because I think I'd rather have everybody feel like their questions are getting answered than sticking to mine. So question from Jenny Keller is that when a young girl enters your program, how long do they get your services and how long are the sessions and classes? And then there are a couple of questions that come back to the
Social media.
phones and social media stuff. So I'll combine those, but if you could just start with just how long.
Yeah, so we work with our partners. So our foundational program is traditionally looks like 10 weeks, 10 once a week after school in an after school setting. But we've gone into schools during the day and then and during health class. We also do weekend programs. And like I mentioned earlier, we also do vacation school programs. So how long can a youth stay in our program? So I'll tell you what has happened in the last 25 years and what we're working on as we move forward. So we have the foundational program that a girl can start at grades 4 through grade 6. That's our foundational program. Then we have what we call an advanced leap program, where when we're talking about keeping ourselves safe, we talk about deeper things, rape. We talk about what can happen if you're in a relationship and tougher things as girls develop and as they get older. Then we have what we have is our teen mentor program. So our teen mentors, they support being mentors to the little girls. So when we go and we teach the little girls in elementary schools, there's also a high school girl there who has also gone through the program, who has had the advanced training, who knows a little bit more, but is able to mentor them, talk to them about being in third, fourth, fifth, and sixth grade and those kinds of things, but also kind of go with them through them learning about using their voice. If they're walking home alone, how do they put, if they need to find an ally in the street. The teenagers help us along with the adult women and our interns from Northeastern, Simmons and Leslie, to teach the little girls. My goal is for when little girls in fifth and sixth grade eventually become our teen mentors. We have two right now who kind of started with us and we kind of just kept them going, and now they're employed and getting paid. And then eventually they graduate from high school and then they become interns and then they come back as lead adults as well. So that is my ultimate goal, to create a pipeline for elementary all the way to college. And we do have some of those, but we need to kind of really that engagement piece. And that's where the social media comes in. So I think I saw another question around developing curriculum. So our curriculum is always developing. Right now, we teach a parent. We had a parent workshop yesterday. The parents were like, jaws were on the ground. They're like, oh my gosh, I need it. So we teach parents about social media contracts, what you can do, because social media is going to be around, right? Even if you try to have your child avoid it, how can you keep them safe on these devices? I think I saw another question around Roxbury and
Yeah.
Dorchester. So right
Yeah.
now in schools, they have to put their phones away. They can bring their phones to school. They have to put them away. There's a lot of charter schools who have these little pouches. I'm not sure if anyone has an elementary school or here. They have these little pouches. They take all the kids and they put them in pouches, and kids can't have their phone till the end of the day. Right now, Boston Public Schools, we're trying to make it that every school is the same. Not when you go to Roxbury, all the kids still have their phones, and in West Roxbury, all the phones are put in pouches. There are differences across the schools and how they're managing this policy. And what is happening? Our kids aren't learning, they're not engaged, and then all kinds of nasty, crazy things are happening throughout the day that translate into after school, and then they have to use their girls leap skills to keep themselves safe. So we are it's not fair and it's not equitable what's happening with the social media and the devices in the Boston public schools right now.
I'm going to pop over to Joe. There was a question from Jennifer Dimmick, about just following up. I think you mentioned the concept of tracking. I know that has
Oh,
some negative connotations, but could you just talk a little bit about that, and whether you're actually sort of tracking how the
yeah.
monies are used, or asking for feedback, or how does that work?
No, I used the wrong word. Yeah, tracking has the wrong connotations, because we don't, and we made a conscious decision when we were starting, um, uh, not not to even look at how any of our participants were spending the money, and for a few reasons. The first is, we just didn't want to be surveilling. That's just not the relationship we want. There's a certain kind of condescension that comes from that, and that's I just I'm uncomfortable deeply with that. But also, we know that in direct cash benefit programs that are left entirely to the discretion of the recipient, this so-called direct philanthropy, um, it is almost never, the money is almost never, if not never, spent on what are called temptation goods. That's an economist term, temptation goods. Things like cigarettes, alcohol, drugs, so on and so on and so on. Um, we also know from all the research, and I don't mean almost all the research, I mean all the research that's ever been done on discretionary funds to individuals, which says, yes, direct trust-based philanthropy. That's what it is. Basically, that says it's almost never spent on so-called temptation goods, most especially with moms and infants. It turns out that poor, our poor people are not lacking in motivation or judgment or resilience or courage or intelligence. Just lacking money. That's it. That's it. Other things go along with that. I understand that, but
Right.
there's a certain track. And by the way, baby's first years does a wonderful job. They're a research operation that has a very similar model, and they've tracked everything, including the way all the money is spent every time. And it turns out that it doesn't even get to a fraction of a percent of the time that it's spent on temptation goods.
I will just note that Jenny Morrison put into the chat the direct trust-based philanthropy, which is something that is very near and dear to TPC's heart. Obviously, it's one of our pillars as well as an
Right.
organization, that we're going to trust you as the organizations who are providing the services to know what is needed and how to spend it in the appropriate way. So
Right.
yeah,
And it works. It works.
and we're all in that same alignment, I think. So
Yeah.
I wondered if I'm looking at the time where we've got time for more questions. If people want to populate the chat, or if you're so moved, you can unmute yourself and ask a question in real time, whatever you feel comfortable doing. One of the questions, I just think I know that a lot of time we're always interested in how some of our grantees collaborate with other partner, not necessarily collaborating with each other, although that would be wonderful, but just how partnerships, how they work with your organizations, had the importance of that. What are the kind of partnership collaboration things that you do that kind of keep you going? And we can start with May, if you want.
Hey, yes, of course. So that's what we do. We and we don't have a physical space where we do our programming. We have to go to a space where the youth are. And so we have been growing our partnerships, growing our in terms of our geography in other towns out of Boston. But I would say our biggest partner is the city of Boston. So we cycle into most Boston public school elementaries at least every 2 years. Our teen program is run out of Dearborn STEM Academy. So there's youth from different high schools in Boston come to that space or other towns in Greater Boston. We are in other towns, Somerville Department of Recreation. We're entering back into Brookline very soon. And the way that we work with the partner, you want us to come to the school, we'll come to the school. You want us to come to your housing development, we'll come to your housing development. You want us to come to the teen center, we'll come to the teen center. So as long as you have a space and you're serving girls and you want to help them stay safe, we will come. And the whole thing is about who pays for what and how does it work, right? And so we always partner on that too, right? Because the programs do cost. We have to bring our teens there, we have to bring our staff in addition to equipment. So it's definitely, as folks from TPC may know, that girl funding is the lowest. And so it's hard to receive funding just focused on girls and non-binary youth. And so we always ask our partners if there is an investment on their side. And sometimes it's hard to get that as well, but we will still come and do our best to provide a program in your specific space.
Yeah.
And we have parents who reach out to us. It all depends. We do get a lot of reactionary calls. So something happened to a child in a neighborhood, the community says we want this, bring it. So we get those calls as well. But we really want the calls before, right? We really want, let's try to like keep girls safe and give them the assets and tools to make them as safe as possible in their communities so they can thrive.
Yeah. Joe, did you want to touch on how partnerships
Sure.
work with family health
Yeah,
projects?
I can be pretty efficient. Yes. In fact, and I've spoken about these entities that federally qualified health centers, which is they're essentially conduits for Medicaid and some Medicare. It's where poor folks get their health care. They're everywhere, and we've found it just such a joy to collaborate with each of them. The two that we've started with. So FQHCs are across the country, and that's a real scale enabler. The other thing we've just done recently is given so many pilots that have gone on over the last 2 to 3 years in direct cash benefit, we reached out to the researchers in the field, and there are 3 or 4 of them. One in particular, an economist who's on our advisory board, a guy named Jeffrey Madrick, but then 3 others who we've just started to build relationships with because the evaluation and the measurement piece, the outcomes piece is going to be so key. And they're they're very much collaborators with us. And then I'd say I'd add to the side, having lived in the corporate world for a while, I was able to get McCann Global Health, was a big advertising firm, and Foley Hoag, the local law firm, and an IT company called Nevo Technologies. Each of them has essentially either reduced their fees dramatically or done their work pro bono. I think of them very much as
Yeah,
really important collaborators.
yeah, absolutely. There was a question in the chat from Nicole, and again, both of you can, it'd be interesting to hear from both of you on this, which is, do people ever call your work radical? And would you consider it that way?
Boy, I hope so. Otherwise, we're wasting our time.
Yeah, it's not a bad
I
thing,
just,
right? To
I
be radical.
no, not at all. In fact,
Yeah.
if anything, you want to be doing something different. And May, I'm sure you're in the same boat, which is the world needs iconoclasts. That's how we progress. We
Yes.
need people thinking differently, and that's key. And then doing the work. That may be the most radical piece of all. Everyone's got a good idea. I got a glove compartment with a dozen really good ideas in it. It's actually doing them, putting them on the ground. I got to say, when you say 26 years, May, I wow,
Yeah. Yes.
that's good.
So, and I maybe I didn't Girls Leap was funded out of, rapes that were happening in college campuses. That's how it started. So it has evolved and changed, and it was definitely post, like after things happened. And so it's definitely changed from we're now focused more on like let's try to eliminate some of those things from happening. So when we talk about radical, one thing I always like to say is we're so lucky in Massachusetts. We're so lucky to have organizations like TPC that can even ask that question and can have these conversations. So I'm it's always a pleasure for me to be surrounded by folks who are doing the work. As someone who grew up in Boston, who has also lived a significant amount of my time on the other side of Route 9, experienced both and understand that there's differences even in Massachusetts. And so the more we can do to help girls and women, the better everything will be.
Thank you. We've got 2 more minutes in the official program here, and there's a question in the chat, and then I may want to ask I have one last question I want to ask both for sure. But this is from Jennifer Dimmick, and it's directed at Joe. The underlying question could be addressed by both because it's kind of related to cuts in funding. But the question is, have the FQHCs, these are like the community health
That's what
centers?
they are. Yep.
Yeah, the way
Yep.
that we hear them referred to. So the
Yep.
FQHCs, have they suffered their own funding cuts under current administration? And is there a danger that such cuts could result in inadequate case management and kind of helping you do your work, right? Identifying the moms, doing the referrals and that.
Yeah. Um, the answer is yes. They've been hit, and they and the actual financial hit is beginning to happen, but will happen mostly next year. So they're preparing for that. Um, the case management piece will likely be the last things to be cut, just because they're so critical and they're direct care.
Mhm.
And in fact, for the two that we work with who are, I mean, they're all good in Massachusetts. To your point, May, we're lucky.
Yeah.
In the Commonwealth, they're all good
Mhm.
and they're well sustained. They usually have other nonprofits or funding sources that sit next to them. There's always a 501c3 that's set up just to help the community health center. So we're in better shape than other parts of the country. But I hope and pray that within a year we're looking at a different feeling politically. I hope, and
Yeah.
and that it should, things can, as quickly as they've changed in the last year, they should be able to change just as quickly the other direction. I hope.
Yeah.
I hope
And for
that
girls.
answers the question, though. I hope that answers the question.
And for Girls Leap, we do get referrals from case managers at health clinics, and a lot of counselors that are working with our girls in elementary schools that perhaps are having some trouble in school with their peers. So that is a piece that, it's subtle, but we do get those calls. And when's your next program? Can I refer this parent to you? And so we're hoping that doesn't change, that the school has a way to kind of pick that up and make sure that, there's no funding cuts in that area, because the counselors in the school are very important. And, they get to see things, throughout the school day that they know may have impacts after school. So we haven't felt it yet, but I hope that doesn't happen.
There's one last question in the chat, which I'm going to read it. Let's try to summarize this. So I think it's primarily asked to Joe, but it's the context of the concept that you can't serve everybody, right? You can't serve everybody that might be in need. So is it the case that you're not serving everyone in need at either of the two centers? And Mom, they hear about the program. Are you in the situation frequently where you have to turn people away?
We avoid that. That's a really great question. And that came up early when we were trying to figure out the best way to find participating prenatal moms. And that's how we came to partnering with community health centers. We've seen other instances, other programs. There was one in particular in Chicago, that actually put up an ad looking for participants, as if advertising money. And it was something like 1,000 slots, and there were inevitably a couple of 100,000 people who applied, which to me is not the way to do things and heartbreaking. So no, we're not known generally, to folks who would feel left out, if that makes sense. Meaning case managers they're not interviewing people. They're not, there's no intake. It's someone is checked through by a case manager and then offered this program. And we've only had a couple of instances I cited earlier, where a potential participant declined. That was recent.
Great.
I hope that answers the question, though.
But I think it's the idea that the model that you are working with is that you go through these referral agencies and have the case management piece to it. And it's just not broad population. I
No,
have one last
yeah.
question. I know we're kind of running out of time, but I can't not ask the question, which is, there's a lot of us here on the call tonight. There's another 230 members elsewhere who might have this question on their mind, which is how and what can we as members of TPC, either individually, what can we do to help or to get involved in the organization? If you could each do that just real briefly, and even if it's just dropping something into the chat, and then we'll do a little wrap up.
Can I go first briefly, Rosemary?
Yeah, briefly you can, May.
All right, so First is I think what's most important to and provide the most impact is our Wednesday Women's Speaker Series. What we do is on Wednesdays, starting in the spring, all through the summer, we have a woman and come speak to our teen mentors about what they do. So we definitely need folks to come to Roxbury. We like to do it in person and speak to our teen mentors, kind of how they got to where they at and what they're doing. So that is like we're always looking for people to kind of fill those spots. Second is that I will invite folks to graduations. Every session we have, there's a graduation where girls not only show their physical skills, but they also demonstrate to their parents and other community folks of what they've learned and how to use their voice in the community to advocate for themselves. So if you live within any of the communities you want to come to a graduation and encourage a girl, we would love for you to do that as well. We're also looking for board members. So if you're interested in sitting on a board, we would love for that. And of course, donate if you can, especially to that food fund. and I
Thanks.
there's a
Joe,
lot
how
more
about you? I know
there.
I'm going to get in trouble for time here, but that's
No,
okay.
no,
Go,
no.
Joe.
Well, I know Katie's still on the line, so she may have a longer list than right off the top of my head. But we did assemble, and I think there were a couple of TPC folks who were on it, an advisory board, and we have some real questions that we're trying to address. Um, they have to do with the program. They have to do with ways to promote. They have to do with ways to cultivate certain types of support, especially lower end support, meaning I'm not big contributions, but smaller donations that come in a sustainable way every month. Six, $7. That's what I want. I want that from lots of people rather than a handful of people giving us a lot of money. There's nothing wrong with that, but that's a big part of what we're about. Katie, are you still on the line? Can you add to that answer? I'm sure you can if you're still on the line.
Let's see, Katie.
I
Maybe
am
not.
on the line.
Oh.
And let me see. Uh, like Joe said, we're trying to engage with as many members of our community as possible. Just trying to share what we do with, more members of the community. I think a lot of people are unfamiliar with direct cash. I think what I put in the chat here is a link to how you can stay connected to Family Health Project.
That's
So
it.
that's
Good.
preceding our newsletter and just reaching out. I mean, we're just encouraging our network to grow. So we've done a number of sort of virtual conversations with people, with some experts in the field. We do some smaller gatherings, but again, just the opportunity to share what we're doing. Of course, funding is super important, but just wanting to grow
And
our audience
to
and just
stay
let people
connected
know
too.
yeah, we
Yeah.
want you to understand what we're doing. So we do have like a monthly communication that goes out sharing news about our moms or research in the field.
And we're thinking about a spring event,
Yeah,
and
don't
that
be a
would be a
stranger.
that would be a big deal. And it would we hope it would be substantial, and it would be about the larger issue of maternal and child health and poverty.
Yeah.
And we've got some ideas about how to do that, but we would love some more input into that project on top of everything else.
And I would just ask both May and Joe, and maybe we can do this offline. And if we communicate out to people who participated tonight, if there's any other links or information like that, we can send that out to people who are here tonight.
Right.
But I just want to thank both May and Joe and Katie and Dana for hanging with us tonight and sharing their time with us. I know that they're willing to stay on for a little bit longer if people want to, but I also respect the fact that I've now stolen 3 minutes of your life that you didn't expect to give. So Sherry has a couple of closing words, and then we can stay on if people want to, and then we'll call it a night.
Well, thank you, Rosemary. And Nicole, if you want to put the slides back up, just the wrap-up slides. Thank you, May and Joe. What an amazing, inspiring discussion we've had. And it all comes down to doing the work. I mean, kudos to both of you. and your organizations. Very inspiring. I'd like to thank Rosemary for helping us through the discussion and some reminders. We have the gift wrapping sessions coming up, the equity challenge, don't forget about that. Letters of intent for our grant process due by January 9th. If you have not volunteered to be on a grant review team, please do so if you're so inclined. And renew your membership for all those TPC members. For everyone, we welcome any feedback on topics of interest, format suggestions, anything that you think of that can make these sessions more valuable. Please be generous in submitting those ideas. And with that, we'll wrap up our formal presentation. And if you're interested in hanging on for a couple of minutes, we'll do that. Thank you all.
Thank you.